there, Charlotte. How are you doing today?
Good, how are you?
Great, thank you. I'm so happy you came in today. So today we're going to review what we saw in our first appointment. So we did a thorough exam. We also did a history and performed some x-rays. Today I'm going to correlate all what I found from that. We're going to talk about the x-rays themselves, follow up with the care plan, what we're going to actually do to help, how long it's going to take, and what kind of goals and aspirations you seek from the care and the financials. Does that sound good?
Yeah.
Awesome. So let's get started. So you came into the clinic and you said that you had low back pain. Where was it again?
Yeah, it's just on the right side.
Right side.
Over here.
Okay, perfect. So I know that your doctor did diagnose you with arthritis at the right SI joint, which does correlate well with what we saw in X-ray as well as what your symptomology is. You also say that this pain is about a 6 out of 10 usually, and you have it about chronically, so about almost every day for about a few hours, correct?
Yeah.
Yeah. So, and you also mentioned that it is it's making it very difficult for you to play soccer and to actually go on long walks with your dog.
Yeah.
Okay. Well, we're gonna see if we can help with that.
Awesome.
So, you were also mentioning that standing and exercising for prolonged periods of time puts more stress on it and inflames and gets really painful and achy, right? And the only thing that makes it better was just sitting and putting heat on it?
Yeah.
Okay, well, we're going to continue with that, but I'll talk about that in a little bit.
Okay.
Okay, so before we continue with the actual care plan, I want to describe more about what's actually going on in your body. So I have a spine model right over here, and I'm just going to explain a few things about what's actually going on in your spine. All right, so first things first, all the white structures here are bone. So the ones right here are called vertebra. This is your ilium, this is your sacrum, and all the little yellow rubbery kind of structures are your nerves, or representing your nervous system. And these are your discs that are between each of your vertebrae.
Okay.
So we're going to be focusing right now on your right SI joint, which you're having chronic issues with. So I don't know if you noticed, but do you see a lot of space in between this joint?
No, not at all.
No, so SI joints are they are pretty broad but very narrow structures. So right here we have quite a few things going to it. We have a nerve, we have space. So having that inflammation as a result of your arthritis has caused further stress on not only the joint but on the nervous system, the other connective ligaments and other structures in the area. So we're going to be working on that. In terms of what is going on. But do you have any questions surrounding the anatomy?
No, makes sense.
Okay.
Yeah.
And I just wanted to further and continue up with what we actually do as chiropractors. We correct vertebral subluxation. Do you remember that from our last discussion?
I remember the word, but I don't really remember what it was.
Okay, no worries. I'll just explain it to you right now. All right, so as I mentioned before, these are our vertebrae, and when we have a misalignment, the misalignment can put stress and put additional stressors on the nervous system and other surrounding structures. As a result, this can impede the function of our nervous system, resulting in lower chain issues and ultimately ending with pain, which is like the last red flag of what's going on. So as a chiropractor, my goal is to help manage and treat subluxations. So we are going to be working on your SI joint as well as some other findings that I found in your low back. All right, so let's look at your x-rays now. So with my magnifying lens, I'm just going to show you comparing this joint, this little line right here, with this line right over here. Does one of them look more narrow than the other?
Yeah, that first one looks a lot more narrow.
Yeah, it's like much more reduced and much more smaller.
Yeah.
So that dysfunction in that joint is why I believe you have some form of SI joint dysfunction going on. But not only is there issues within the SI joint here, but we do notice in the lumbar spine or the low back here, you do have an accentuated curve. So the increased curve here is putting further stress on your mid-back, which you also complain with other tension and issues in, as well as your overall pelvic area. So your pelvis, as I showed before, was the sacrum and ilium. This area is being pulled further back, as well as your mid-back here, to where the mid-back and the pelvis are so behind and posterior that the lumbar spine has extra stress on it. This extra stress not only puts additional constraints on your low back, but it can result in pain as you experience from this dysfunction. So our goal is to help improve the alignment and function of this. I'm just going to show you right here a typical lumbar x-ray just to kind of see what the differences are. So the white parts is essentially for the bone and the spaces are in between the discs. Do you notice any like really big difference between your curve and this curve?
Yeah, mine's a lot bigger than that one.
Yeah, so our goal is to have it so that there's enough curve that it's functional but not too much that it's beyond stability. Because if you think of it this way, if you have a C, you have much more stability, whereas if it's almost flat like this, you have virtually no stability going on there. So, the importance of this is that I won't be able to actually increase the size of your discs here. However, I'm going to help improve the functionality of your overall joint and motion and space and help coordinate that better.
Okay.
So you can play a better game of soccer and enjoy being outside and exercising.
I love that.
Yeah. Alright, so to further this up, let's talk about your care plan and what we're going to do to actually help you with this. So the first line of care is going to be chiropractic adjustments. So we're going to be applying specific gentle forces onto certain segments and joints in your body. The reason we do this is to help improve mobility and also help eliminate subluxation. We're going to follow this up with other modalities such as heat packs, which we'll be applying at home, as well as our corneal laser, cold laser, which we're going to use to reduce the edema on that SI joint. So with that in the office, we're also going to be doing stuff at home that I'm going to need your participation for in order to improve your overall care and improve your overall goals. So would you be willing to help out with that?
Yeah, absolutely.
Great, that's what I like to hear. So we're gonna, at home, gonna have you use your hot pack once the pain is beyond your typical 6 out of 10. I'm just gonna have you put it on for 20 minutes, just in a resting, laying on your stomach position, and then do that for approximately 20 minutes and then off, and then another 2 hours I do it again for 20 minutes.
Okay.
Like I said, whenever the pain gets bad, but if it's not beyond that level, maybe about 3 times a week just to keep it even and consistent. I'm also going to suggest that you avoid laying on your stomach or further exacerbating that curve on your low back to eliminate that issue. And encourage you to wear your orthotics that were prescribed to you to improve your overall foot function to help improve the overall gait so it doesn't put extra stress on your SI joints.
Okay.
Sounds great?
Yeah.
Awesome. Okay, so in relation to all of that, I'm going to have you come in and then your overall care plan will involve you coming in 2 times a week for 8 weeks. Once that's done, we're going to do a reevaluation and see where we're at. And from there, I'm anticipating, based on my clinical experience, that it'll take about 3 months to get to a point where we're at a functional, comfortable, and movable level that you're and I am both comfortable with.
Okay.
Beyond that, we'll try to continue with wellness care and maintaining that stability and function in your body. Alright, so do you have any questions surrounding that?
No, that all sounds great.
Okay, great.
Yeah.
I'm glad to hear that.
Yeah.
And just to summarize everything, you were saying initially that the main reason why you came to see me is to get out of pain so you could actually go on for long walks with your dog because you really enjoy that.
Yeah.
Yeah, like living in California, it's really nice being able to go for hikes and
Oh,
it's
for sure.
such a damper not to be able to go and do that.
Yeah.
So with this care, we're gonna be getting you to a level where you're able to function at your peak and help you improve your ability to go on long walks, as well as play a full game of soccer, because I know you're a semi-pro athlete and that's very important to you.
Yeah.
Yeah, so with that in mind, I have the exercises right over there. We're gonna go over to the exercise room and I'm gonna show you how to do these exercises properly, so you can stabilize your core and as a result help coordinate your muscle groups, alright?
Yeah.
And then at the end we'll go talk to our financial advisor and figure all the financials, alright? Sounds good. Thank you so much,
Thank you
Charlotte.
so much.
Have a great day.
Thanks.